बरेचदा म्हाका एक प्रश्न पडटा. आता आमची लायफ फास्ट जाल्या काय आमी ताका सुपरफास्ट केल्या आणि सुपरफास्ट जर केल्या जाल्यार आमी स्वताच्या आपल्या हेल्थाचेर लक्ष दिता काय ना. अशें आसतना एक दीस आमकां विकांतल्यान मेळटा किंवा वर्सांतल्यान एक दीस मेळटा जेन्ना आमी ट्राय करता फोकस करपाक आनी रादर लायफाचो कंट्रोल घेवपाक. तो मागीर फोकस आसूं किंवा रिसेट आसूं. आयज आमी ज्या दिसा बद्दल उलयतात ते म्हळ्यार वर्ल्ड किडनी डे. आता हो जागतीक दीस आनी ह्या दिसा आमचो प्रयत्न की ह्या किडनी बद्दल जे आमचे व्हेरी इम्पॉर्टंट ऑर्गन आसा त्या बद्दल जाणून घेवपाचें आनी जी दुयेंसां आसा ती दुयेंसां न येता आमी हाजी काळजी कशी घेवं शकता हाजेर आमी हो आमचो कंप्लीट यत्न आसा. त्या खातीर आयज आमच्या स्टुडिओन आवर्जून आसा डॉक्टर शीतल लेंगडे जे आसा कन्सल्टंट नेफ्रोलॉजिस्ट आनी किडनी ट्रान्सप्लांट फिजिशियन फ्रॉम आरजी हॉस्पिटल्स. सर, वेलकम टू द शो.
थँक्यू.
आता मला एक सांगा की आपण वर्ल्ड किडनी डे हा दिवस साजरा करतो, सेलिब्रेट करतो. ह्या किडनीच्या बद्दल जे आपलं एक इंटेग्रल पार्ट आहे आपल्या ह्युमन बॉडीचा, त्याबद्दल तुम्हाला काय सांगावंसं वाटतं, एस्पेशली पीपल हू आर नॉट अंडरस्टँडिंग देअर बॉडी. कारण आपण बरेचदा आपलं एवढं लाईफ कॉम्प्लिकेटेड झालंय किंवा आपण करून घेतलंय ते. काय म्हणणार तुम्ही?
तर second Thursday of March every year is celebrated as World Kidney Day. And this celebration or sort of awareness has been started since 2006 onwards. The main reason why this was started was to promote the importance of the kidney as an organ in our body. And the focus is basically to understand how kidneys are really important for our overall health. Now, kidney, we all know it works as a filter. We all know that the most important function of kidney is to filter the blood and to excrete the waste products in the form of urine. But that is not the only function. We have to understand that there are many more functions of kidney which are there apart from its most important function, which is filtration of the body or filtration of the blood. So maintenance of normal blood pressure, maintenance of normal blood count or hemoglobin, what we call it as, maintenance of good bone health.
Correct.
These are all functions of the kidney which most of us don't realize.
Ignore rather.
It is only when people develop kidney disease that all these things are brought into the forefront. But these are all very important functions of kidney. So to have a normal health, one has to have normal kidney function. And that is the reason why World Kidney Day was started, so that everyone makes a comprehensive effort to understand the role kidney plays to maintain our health.
Correct.
And for that purpose, it is not just a matter of one day, but at least that day one should be aware that this is an important organ and we should be taking care of it throughout the year.
Okay, you have very nicely made us understand the significance of kidney and what role does it play. I really want to ask you is, if we don't take care, then things get worse. And I really want to know is, what are the common kidney diseases and what are the causes? Obviously you said filtration. कुठेतरी काहीतरी गडबड असायला पाहिजे, तेवढ्यातच ते फिल्टरेशन the cycle is broken. Is broken. So I really want to know is the causes and the symptoms.
So the common causes of kidney disease, or what we call it as chronic kidney disease. The commonest cause all over the world and in India and in Goa too is diabetes. So 30-40% of the patients who develop kidney disease is because of diabetes, which has not been controlled properly or which has been neglected in the most part of its course. So diabetes is the leading cause of kidney disease. After diabetes, it is high blood pressure, which is the second most cause of kidney disease. So if these two diseases can affect more than 50% of patients who have or will be seen in more than 50% of the patients. Following these two, we see conditions like heart diseases leading to kidney problems, people with recurrent kidney stones developing chronic kidney disease, people who consume medications, especially painkiller medications, for a long period of time developing kidney disease. Then certain kidney diseases are seen in patients who have congenital or by birth there are defects in the kidney and in the bladder. So that is also one of the common causes.
Is it a hereditary? I don't
know. Yeah, some patients do have hereditary causes of kidney disease, and the most commonest example is something called as polycystic kidney disease, where we find that the kidneys start becoming bigger and bigger or ballooning in size. Usually starts happening, it is the defect by birth, but usually starts coming to the clinical fore once you cross 30 years of age. So that's a hereditary disease which we see.
So you don't realize till 30th only?
After many people don't realize because the only way you can diagnose it is by doing an ultrasound, and most of the time it is not having any symptoms. So unless there is a strong family history, one would not be really aware about it in the early stages. So these are the usual causes of chronic kidney disease. But as I said, diabetes mellitus and hypertension make the majority of the reasons why people develop kidney disease, and then there are other less commoner causes. So now in a country like India, we have some other unusual or more causes which we see here, like for example pregnancy associated kidney diseases are quite one of the reasons why people develop kidney disease. Then sometimes or many a times you can see snake bites causing kidney failure, which may not recover, and patients can develop chronic kidney disease. Indigenous medication usage is very prevalent in our country. So people continue to take medications on their own, be it any alternative medications or some Chinese medications which were basically used for obesity and those things. There have been some studies which have shown that even using fairness creams, fairness creams which are otherwise supposed to be very harmless and are supposed to give glowing skin, but fairness creams which contain excessive amounts of mercury and lead have known to be causing kidney disease. So these are some of the things which we have to be aware about. At the same time, the environment also plays a very important role. So in a very hot climate, if you are working out in the fields, and this is true for farmers and laborers, where they are exposed to extremes of climates, a very harsh, a very hot climate, and if they are not having enough liquids, then that can predispose them to develop kidney disease, and this has been shown in tropical countries, one of the reasons for people developing kidney disease.
But if I want to ask you is, if somebody wants to look out for signs and symptoms, that's the first sign where you can kind of course correct yourself or take the advice of the doctor. What are the signs and symptoms that one should look for, and also is it restricted to a certain age group, or is it open to all now? Because our lifestyle has changed, and that is very important for us to understand.
Yes. So the problem with chronic kidney disease is that in the majority of the time frame, the patient is asymptomatic. So the patients usually don't come to the doctor saying that I have a kidney disease, because the symptoms are not seen in the initial stages of kidney disease, and symptoms usually start in chronic kidney disease very late. When more than 80% of the kidneys are actually damaged, that is when you start noticing symptoms pertaining to kidney disease. Now symptoms can be swelling over the ankles, swelling over the eyelids, puffiness of the face, feeling fatigue, feeling tired, not able to concentrate in your day-to-day work, poor quality of sleep, excessive, now some patients may complain that they have to get up in the night frequently to pass urine, and that is one of the symptom which can point towards kidney disease. So getting up more frequently in the night to pass urine. Some patients may notice that their urine quantity has become less, or there is an excessive frothing in the urine. That is also one very peculiar symptom which we see in many patients, especially patients with diabetes or hypertension.
Okay.
If they find that their urine is becoming excessively frothier than otherwise, then they should always look out for kidney disease. So these are the usual symptoms which can be seen. These can be seen individually or they can come together. But mind you that most of these symptoms come very late. There are no early symptoms of
Can you identify a stage that that you realize that these are the symptoms? Is stage number 1, 2, 3?
So chronic kidney disease, we stage them based on something called as what is your GFR.
Okay.
Now GFR or glomerular filtration rate is the actual number which is supposed to tell you what is the kidney function.
Okay.
So when we say normal kidney function, it means that your GFR is above 90 to 100 ml per minute. That is the normal count. So as the GFR starts going down, as it goes from 90 to 60, we start sort of staging the disease. So for example, the GFR between 30 to 60 is called as stage 3 chronic kidney disease. GFR between 15 to 30 is called as stage 4 chronic kidney disease. And kidney failure, we say when the GFR is below 15, or what is called as stage 5 chronic kidney disease. So one should not blatantly say that I have got kidney failure. Kidney failure is a very specific term which is used when your GFR is below 15.
Okay.
Because that is the time when you are actually requiring to start dialysis or consider transplant. So that stage you have to take help of dialysis or transplant to survive normally.
Okay.
Otherwise, without treatment, stage 5 kidney disease does not give you a very good lifespan.
Okay.
So based on what is your GFR, we stage the kidney disease.
I think I will go in detail just to understand the process of dialysis. I really want to ask you is, one is you need to be hydrated is something that you just mentioned while talking. Harsh sun is one of the causes. Another is hereditary that you've spoken. I really want to know is what are the preventive measures, especially when you can't avoid harsh sun, when you maybe have it's in your DNA maybe, maybe for some reasons you are drinking less, whatever one should not is the first bottom line, but you still end up drinking. What are the preventive measures which you can take care of your own rather than visiting the doctor? Yes. The doctor becomes the second part of the story.
Yes. So it is very important to understand that there are simple ways or I would say simple tips to maintain normal kidney health. So if you actually go one by one, first is to stay active and fit. That is the most important mantra for preventing any disease. If you are active, if you are fit, yes, you will be fine. Second is maintain normal health. Don't be obese, because obesity is one of the most important reason why people can develop kidney disease. Obesity obviously is one of the reasons why diabetes, hypertension and all these other comorbid conditions will come into. Then third is ensure that you are well hydrated. Now when I say well hydrated, it basically means that for an average adult you should be at least having 8 glasses of water per day. That is a minimum requirement, that you have at least 8 glasses, which is equal to roughly around 2 to 2.5 liters of water per day. Good hydration is very important because that plays a very critical role in preventing kidney diseases.
Correct.
Then if you have diabetes, your blood sugar has to be controlled, and control has to be right from the time diagnosis of diabetes is told. Because if you control the diabetes right from the time you are diagnosed, the chances of developing kidney diseases go very less. So a person with diabetes should be knowing his numbers, and numbers, when we say, it is basically that your HbA1c has to be below 7%. That's the number which we tell to most of our patients. Then if you have blood pressure, your blood pressure again has to be well controlled, and well controlled meaning a blood pressure below 130/80 with the help of medications. You may require one medicine, you may require 2 medicines, but you have to take those medicines to keep that blood pressure below 130/80. If the blood pressure is well controlled, the chances of developing kidney diseases become very less. Then if you have any family history of kidney disease, then you should definitely be careful. You have someone in the family who has a kidney disease, either because of diabetes, either a hereditary kidney disease, you have to get yourself checked.
Correct.
And you have to get yourself checked at least once in a year to ensure that your kidney function is normal. And the last thing which we would tell is avoid taking over-the-counter medications.
So you don't be the doctor.
You don't be the doctor. You don't start Googling and treating yourself, especially if you are taking painkiller medications, that too without prescription for a pretty long period of time, then you are most likely inviting kidney disease for your own self. So we suggest that avoid taking over-the-counter medications. If you have any reason to take medication, you consult your doctor and make sure that the medication is taken for that prescribed period
I think
of
it's
time.
not always AI can help you. Sometimes human intelligence is what you require, because that's the personal recommendation that somebody can give you, and especially you need to visit a doctor if you find any kind of such symptoms.
Yes.
Once you have developed the symptoms, once you are aware that whatever those things that you have mentioned are I am encountering it. How does one go about? Is there a test, a blanket test? You mentioned that if at all it's there in the in your parents, it's in your
Yes.
family.
Yes.
You need to do a certain test. What
Yes.
is that test?
Yes.
Is it applicable for all? And what is that stage, or maybe initially the moment you feel something, can you do that test? How does this test work?
So for all people who are at high risk of developing kidney disease, and this high risk category includes people who have diabetes mellitus, people who have hypertension, people who have family history of kidney disease, people who have heart diseases, people who have history of recurrent kidney stones, or even sometimes we advise as a screening measure. There are simple tests which can be done to diagnose kidney disease. They are very easily available in all hospitals. They are easily available across all the laboratories in the state. So we do a urine test to detect something called as albuminuria.
Okay.
So it is basically looking at the presence of albumin in the urine, or more specifically we do something called as a urine albumin creatinine ratio, or you can call it as UACR.
Okay.
So if you do this UACR and a blood test called as serum creatinine, blood test can also be summarized as kidney function test, but more specifically I would say looking at serum creatinine. So if a diabetes or a person with hypertension does this UACR and serum creatinine at least once in a year, then you are never going to miss kidney disease. So as a precaution, we advise all our diabetics, all our hypertensive, all people who are at risk of kidney disease, that you check your urine for albumin and you check your blood for creatinine level. These two tests are very simple, they are very cheap, they are easily available, and they are very reliable in terms of detecting kidney disease. So you don't have to do any ultrasound or a CT scan or a biopsy or any of these.
You can rely on the results.
You can just rely on a simple urine and a blood test, and you would be rest assured that if these results are normal, your kidney function is normal.
But sir, my very important question, I think, which my viewers will also like to relate, is all our lifestyles have changed, our food habits have changed, our sleeping cycle has changed, the way maybe our parents used to work is way different than what we undergo, and I sometimes get scared how the next generation will function. So how does this food and lifestyle play a very important role in maybe taking care of your health first, and also secondly is your kidney functioning, so that it doesn't affect your routine life?
So I guess we are I guess what we eat, that is what it's a saying, and yes, our eating habits definitely define or would tell us what we are really going to be as far as our health is concerned. Yes, in general, if I would say you should be having a healthy lifestyle, it basically means that you have to have healthy eating habits. Healthy eating habits, obviously, we know that the best place to have good food is in your home. So home cooked food is what I would advise, because the benefits what you get by eating at home can never be surpassed by eating in any fancy restaurant or ordering on any of those apps which are available. So yes, freshly cooked home food is the best way to stay healthy. Yes, you would be sort of precautious about including vegetables, grains, lots of fruits, salads in your day-to-day eating styles, because those are definitely healthier. As far as kidney health is concerned, yes, having lots of fruits and vegetables, ample water is definitely going to be protective towards your health. People who indulge or who are more of non-vegetarian, yes, we do say that you can have your portion of egg white, fish, chicken. But yes, you be careful about having red meat as far as possible. If you can avoid red meat, it is going to be good for your health. But yes, a good portion of fish, chicken, egg can definitely be a protein source to keep you healthy. Fries, fried food, colas, soft drinks, these are definitely not
to be avoided,
not recommended. These are definitely to be kept only on social occasions, if I would say. But on a day-to-day basis, yes, there is nothing to replace water as a liquid, which is the best.
I think, sir, the things that you have mentioned with respect to maybe food and also the drinks that we usually have occasionally is something that a lot of viewers watching might envy, saying that why we don't want to do that. But then again, if you don't, then you end up getting kidney diseases. And if you do, then what is the treatment? Because I've seen a couple of patients. And life is very difficult, not just for the patient, but also towards the family members. And this I'm very specifically, saying of patients undergoing dialysis. Though it has evolved over a course of time, but still it's a lot of pain which goes through. Not physical maybe, but there's a lot of trauma that is part of the emotional ecosystem.
Yes.
How do you take up people who have come to you with the kidney disease? What is the approach of treatment? And also something which is quite common is dialysis. The moment we say kidney, it is dialysis that we associate. Everybody goes to dialysis? I don't think so.
No. So as we talked earlier regarding the stages of kidney disease. So as I said, it is only when you reach stage 5 chronic kidney disease, that is when your GFR is below 15, is when we discuss about the option of dialysis and transplant. Now, in all the earlier stages of kidney disease, it is basically the medications which are there for either your diabetes or blood pressure, medications which are there to improve your hemoglobin level, because low hemoglobin is very common in kidney disease. And there are medications to sort of strengthen your bone health, medications to reduce the excess water and salt which you have generated because of kidney disease. So the initial stages of kidney disease are well managed by medications and with the help of diet. So even in chronic kidney disease, when patients advance into kidney failure, there is a diet which we sort of modify or tailor to each patient's need, and that helps to slow down the progression of kidney disease. Now, it is important to understand that not all patients who have kidney disease will develop kidney failure and will require dialysis.
Correct.
Majority of them, if diagnosed early,
You can reverse it?
can be managed by medications.
But can you reverse it back to normal?
So we may not be able to reverse most of the kidney diseases, but we may be able to slow down the progression of kidney disease. So say you are going to require dialysis by the end of 5 years with the help of medications, with the help of diet, with the help of lifestyle. That 5 years can be extended to 10 years or 12 years.
Nice.
So you can still have a good dialysis-free life if you stick to the diet plan, if you stick to the medication, if you stick to the follow-up which the doctor recommends, and if you avoid unnecessary further damage to the kidneys. So that is what we advise to most of our patients.
Okay.
Yes, it is also true that many a times patients come to us when it is too late. And we see many patients who come to us directly in stage 5 kidney disease when they have to start dialysis immediately. And yes, in those patients, we do explain them about the options of dialysis and the option of transplant. As the medical science has advanced, so has the science of dialysis and transplantation also evolved. Patients, when we first tell them about dialysis, many of them are very anxious, they are scared because they have heard about someone undergoing dialysis and having problems 10 years back or 15 years back. But I would want to tell you that the dialysis treatment has gone leaps and bounds of evolution, and it has become more patient friendlier than it was ever. So now when we have to start someone on dialysis, one should not be really worried as to what will happen to them, whether it will be painful, whether they will be unconscious, whether they will have any physical problems on dialysis. So nowadays dialysis therapy is very comfortable. It is painless. Patients can eat, drink, they can watch TV, they can listen to music during their dialysis treatment, and at the same time they are going to get better and better once they continue on dialysis. So one need not be scared about dialysis if it is required.
So you touched about transplantation in between while speaking. I really want to ask you is how does this organ donation and transplantation work? Because this year, the early first 2 weeks, we saw 3 cases of organs being, donated.
Yes.
And I believe, a couple of lives would get a refreshing take to the life, especially with those organs.
Yes.
How does this function?
So yes, you rightly said that in the beginning of this year we had 3 cadaver organ donations, and cadaver organ donation is basically donation of organs which happen with the consent of the family. Once the patient is declared brain death. So once a patient is declared brain death, the family is counseled, the family is explained that brain death is equal to death. That concept is important to understand. And once they realize that their family member is no more, they are counseled about the noble act of organ donation. Most of them who have consented for organ donation are already aware, either through newspapers, either through television media, or through the radio, or through social media nowadays, about organ donation, and that one person can save 8 lives if the organs are donated on time. And so similarly we had these 3 organ donations or 3 cadaver donations happening, which saved 6 patients definitely received kidney, but few patients received heart, lung and liver through this donation. So this is definitely saving lives and giving a second innings, I would say, to many patients who are otherwise surviving with organ failures. Now, as far as kidney failure is concerned, dialysis treatment is there. Dialysis can still make you lead a fairly normal and healthy life in spite of having kidney failure. But someone who has got say liver failure or heart failure, they may not be that comfortable because those therapies are not easily available and they are not as easily accessible as dialysis for kidney failure.
Correct.
So a kidney failure patient can start on dialysis and then consider transplant as the best option available. Now, when we say kidney transplant, you can have transplant either from a living family member, which we call it as a living transplant, or through a cadaver organ donation, which is called as cadaver transplant. Now, for living transplant, the requirement is to be a close family member. The donor has to be a close related family member.
Has to match.
Obviously, matching comes the next, but by the Organ Transplant Act or by the laws which are governing the transplant process, family member has to be the first degree relative. So it has to be either a grandparent or a parent or a brother or a sister or a child or husband and wife. They are allowed to donate amongst themselves. So close family member is the first requirement. Obviously, we then look at what is the blood group, how well matches the blood group, and then we look at the tissue matching or HLA matching, what we call it as in organ transplantation. And then there is a medical evaluation which is done for the donor and evaluation done for the patient as well. And once all the evaluation process is completed and we find that the donor is mentally fit, physically fit and motivated to donate the organ, that is when we ask for permission for organ transplant. There is an authorization committee which is based in Goa Medical College for Goa. We have to seek permission for every transplant which is done from the authorization committee. Once they scrutinize and approve, then the hospital conducts the transplant.
Okay.
So this is how, though it sounds very laborious, but it's actually not a very difficult process.
Decision to make, especially when you have the loved one on the other side.
The most important or the most important process or time which is taken here is for the family to decide who is going to be the donor.
Correct.
That is the most important time or the most important hurdle, I would say. Because the family, if they decide that yes, we want our family member who is having kidney failure
to donate,
to come back out of kidney failure, and we are there to support him.
Correct.
And me, myself, or my brother or my father is going to be a donor, then the process is simple. So it is the initial process which takes time. And I understand it is
it's
completely normal.
Emotional decision
yes,
to make.
It is not just emotional. There are many intricacies involved which decides about donation.
I think our body is a vast subject, and kidney is one such that, if we deep dive, we can go on and on and on. We're running short of time, but I think for anything and everything, there is one life mantra: prevention is better than cure. Doctor has given a lot of tips as to how to avoid kidney diseases. I really want to say thank you, doctor, for visiting our office and especially sharing your valuable thoughts on this World Kidney Day. We look forward for a healthy Goa and obviously a healthy India. But again, if there is anything that needs a doctor's intervention, I think one thing that you clearly mentioned is people should visit to the doctor, take expert advice, and not take over-the-counter medication or be the AI or the chat GPTs and take control of their life. I think that is where we all need to course correct or correct ourselves. It was a pleasure to have you, sir. Thank you very much for sharing your thoughts. Thank you very much.
So as the World Kidney Day theme this year says, are your kidneys okay?
Yeah.
And that is what I would suggest, that each one should ask your own self and your family members that are your kidneys okay? And you can detect kidney disease early, and that is the only way you can protect your kidney health.
True.
So prevention is definitely better than cure, but detection in kidney disease is most important. If you detect it early, you can take many measures to keep it healthy.
Very true. Dr. Lengade, thank you very much. It was a pleasure to have you in the studio. Thank you.
Thank you.